Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop Quervain's Tenosynovitis pain at home. But before I do that, I will go over basic anatomy of the thumb. Then I will go over the causes, the risk factors, normal healing cycle, and what you should do at home to get to the root cause of the problem. So first, we need to understand what is synovium. Synovium, as you see here in this image on the left side, the normal joint, you have the synovial fluid, that's the blue part here, and then the yellow outer layer, that's the synovial membrane, and that's encapsulating each joint. Actually, it's kind of like you have that fluid between the joint. Let's say this is your joint, you have the top bone and the bottom bone, and in between you have the capsule of the synovium, the membrane that actually attach both joint together, and in between those capsules, actually inside, that is the fluid. So this way it helps things lubricated and smooth, so it will move smoothly. So with synovitis is actually inflammation of the synovial membrane and actually the fluid, and you can see here in this image you swelling in the synovial fluid, and you start to have irritation and inflammation in the synovial membrane, and usually sometimes it happens you start to have bone erosion, as you see in the second image. The other thing we need to understand is the retinaculum. The retinaculum is a deep fascia layer that's actually wrapping the tendon, and you can see it here. It's actually wrapping the entire area in the wrist area, the retinaculum. It's kind of like keeping everything in place like this, like the other hand, this hand, the retinaculum. So that's part of the fascia layer, and that's very overlooked with a lot of healthcare providers. And briefly, I'm gonna cover different layers of the fascia other than the retinaculum in this video. So the deep fascia, the retinaculum, is actually holding those the tendon here, and when you start to have tenosynovitis, you start to have inflammation in the tendon too. So inflammation in the synovial tissues, and also inflammation in the tendon, and that's also affected the extensor retinaculum that's wrapping everything on the top of it here. So you have issue with the joint, you have issue with the tendon, and then you start to have issue with the extensor retinaculum, the fascia layer. So you can see here in this image with Quervain's Tenosynovitis, you have issue with the tendon, you have issue inflammation in tendon, synovial tissue, and the retinaculum, and it swells here, so it's actually in the way of everything, and that will cause pain, clicking, and difficulty with the gripping or writing. Symptoms: swelling, pain with gripping and catching feeling when you start to use your thumb, and also turning or grasping, you start to have pain with that. So what are the causes and risk factor for Quervain's Tenosynovitis? First cause is usually repetitive strain injury that occur from repetitive motion, like writing for a very long time, typing for a long time, or carrying a baby. Also, you might have it from direct hit or trauma that happened to your thumb area, and this area also could happen. Or risk factor, other risk factor is pregnancy, job hobbies requiring a lot of like grasping or nailing or something like that. So the main question is how to treat it. In order to do that, we need to understand the normal healing cycle, because it will make sense how to get to the root cause of the problem. I'm gonna use external paper cut for visualization, but the same process happened internally with the Quervain's Tenosynovitis. So the first stage of healing is inflammation, and you can see it here in this image: swelling, redness, the blood start to rush into that area, and actually by definition Quervain Tenosynovitis is actually inflammation here in the tendon and the synovial tissues. So there is always inflammation with this condition. The other stage of healing is a proliferation stage. Your body starts to build a scar tissue, as you can see it here. If your body does not build a scar tissue, it's open wound susceptible for infection. So internally, when you do the repetitive motion, you cause micro tear internally, you cause tear in the tissue, you cause inflammation. So your body natural way of healing is actually building scar tissue. The problem is when you have too much of the scar tissue, and you can see it here, is the tissue are swelled up, scarred, that prevent the elasticity of your tendon and your muscle, so it will cause pain. During this stage, actually, there is also fascia restriction, muscle spasm trigger points. Perfect scenario during the maturation stage, the last stage here in this image, your body starts to get rid of the scar tissue, the fascia restrictions, clear up all the inflammation, and everything's heal. So if you have chronic condition, you're probably going back and forth between inflammation and proliferation, like this image, which by definition actually Quervain's Tenosynovitis is actually a lot of inflammation and proliferation, which is scarring and fascia restrictions. So all of that's going on in the thumb area. So how to treat it? Before I do that, I'm gonna go over current treatment that actually does not work very well, so you don't have to waste your time on it. We're gonna relate that to the normal healing cycle, so it will make sense why you don't need to waste your time on this treatment. One of the common things that use is stem, heat, and ice. And when we look at the healing cycle, it's not gonna do much to break the scar tissue, any adhesion, and based on the studies provide temporary pain relief, lucky if you feel relief for half an hour, but does not do much for inflammation or proliferation. The other thing that commonly used is massage and foam roller. The problem with that, if you have inflammation or open wound and you keep rubbing it, you're gonna inflame it more. And based on the studies, does not provide long-term pain reduction. And when I go over the fascia system, you will realize how it's impossible for the foam roller and the massage to release deep adhesion, because mechanically impossible with working superficially with the foam roller or with the knuckle when you do massage, or the elbow, to go deep to deep adhesion release. The other thing that commonly used is actually stretching, and the problem with that, if you overstretch inflamed area, it's gonna inflame it more. Think about this way: if you have a micro tear in the muscle and you keep stretching it, you're gonna tear it more. I personally do not recommend stretching for my patient. There's other alternative, a safe option than stretching that can be done without causing harm. The other thing that's commonly used with the healthcare provider, joint mobilization, adjustment, or manipulation, used by physical therapy, chiropractor, and occupational therapist. And the problem with that, when we start to look at the healing cycle here, you're gonna move the joint, but the problem is inflammation. If you overdo it with moving the joint, you're gonna cause more inflammation, but that will not do a lot of work to help with the proliferation stage. And based on the studies, it does not provide long-term pain reduction. So what should we do at home? Well, we have to address the inflammation and the proliferation stage simultaneously, because that's part of this disease. So to work on the inflammation, I will avoid, first thing is the repetitive motion that you do. If you do a lot of typing or writing or like grasping or a lot of hand work, I will do stuff that avoiding this repetitive strain, so it will start to heal. At the same time, I personally use the Magna Heal 2, and this Magna Heal is actually a very strong magnet. The magnetic range is about 3 inches that can penetrate the body actually to decrease inflammation. So the other thing I like to do is to put all of my patient on anti-inflammatory diet, because there is certain food that actually cause internal inflammation and slow down the normal body healing cycle. One of the other things that overlooked is you might have vitamins and mineral deficiency that actually prevent you from going from inflammation, proliferation to maturation stage. And one of the way to figure out what's going on is just take advantage of Ask ASTR. It's a free online medical evaluation. The software will help you to figure out what possible vitamins or mineral deficiency you might have that prevent you from healing or decrease the speed of healing. So at the same time, while working on the inflammation stage, we have to address the proliferation stage. So what I personally do is using the A3 to break the superficial scar tissue, release all the scar tissue in the tendon area and also in the muscle area with the A3, and I use the A5 to break deep adhesion and release deep adhesion in the whole area. And that's why I said massage is not very effective, because you cannot go deep enough as the A5 to really cause deep adhesion release. I will briefly go over the fascia system because it's overlooked by a lot of healthcare providers, and that's part of the treatment of the Quervain's Tenosynovitis. So the fascia system is divided to two main groups: superficial layer wrapping the entire body, and you have the deep layer wrapping the deep tissue. So as you can see here in this image, the superficial fascial layer is actually the tissue that's here, the white web tissue, that's the fascia. And actually when you get a stick next time, you will see the white filament here is actually, that's the fascia. So it's to make things more complicated, but don't worry, the treatment is very simple. Each of these layers is actually divided to 2 to 3 sub layers. So as you see here in the image, and the deep layer is actually divided to 4 subcategories: the apparatic fascia, the epimysin, the premiysin, and endomysin. And you can see here in this image, the apparatic fascia is actually wrapping a group of muscles, and then you have the epimysin that's wrapping each individual muscle fiber, then the premiysin wrapping a group of bundle of muscles fiber, then the endomysin each individual muscle fiber. And that's why I said it's impossible for massage and foam roller to go deep to release those adhesion in the deep tissue, because mechanically impossible with the knuckle or the elbow to go deep. It's like, you know, you want to unscrew a screw inside the motor, but the screwdriver you have is very short. It's impossible to actually do any release internally because the tool you have is very short, which is your hand. So what I personally use is the A1 to release superficial apparatic fascia, and then I use the A5 to release the epimysin, premiysin, and endomysin. So to sum it up, what should we do at home? First, you need to avoid the trigger. So if you do a lot of repetitive motion that require using your thumb or your hand or your wrist, I will avoid those motion. Just give it time to rest. At the same time, we have to work on the inflammation and proliferation stage simultaneously. You cannot pick and choose, okay, I will use a MagnaHeal or anti-inflammatory diet to help with decrease the inflammation, and we're avoiding working on the scar tissue fascia restriction, because that's not really addressing the whole issue that you might experience. And that's conclude our video. We'll see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.